And these are commercially available products. We at Stanford still have our medical students do cadaver dissections. We feel like that's an important part of learning. It's also an important part of developing the culture of respect for the human body. But those dissections are supplemented now by virtual reality and increasingly augmented reality approaches to really understanding the three-dimensional aspects of anatomy. So there are electronic simulations where you can look at any plane you want to in the body. You can insert specific muscles, take away muscles. You can understand the pulling direction of muscles much better than you can from a cadaver dissection, certainly much better than you can from a textbook. So that's being used today. And in a more direct clinical application, our neurosurgeons have a system that, operating the brain is complex. And every tumor, every structural abnormality is a little bit different. So the surgeon can work with a virtual reality set to actually do the operation virtually, based upon where the tumor is located, and be able to see the relationship of the tumor, for example, to blood vessels and things like that before they ever get into the operating room, and have a much better understanding. Okay, this is these are the steps I'm going to need to take. This is what I'm going to need to watch out for at this particular point of the operation.
So it's almost like a flight simulator version of a surgical procedure.
That's
where you're
right.
having
That's right.
an almost tactile experience of doing it without the risk.
Exactly.
Yeah, that's amazing.